I'm Dr. Sala Saketa, and I'm a medical epidemiologist and public health physician working with the Pacific community over the last 6 years. And prior to that, I've worked with the Fiji Ministry of Health for over 20 years, and in various levels of the Ministry of Health, worked at the Frontline and also worked at the strategic level. And I left the Ministry of Health as the Permanent Secretary for Health. We all agree that no vaccine or any medical measure is 100%. But the good thing about COVID-19 vaccines that are available right now is that it prevents you from getting severe infections and death, and that's what we are urging everyone, that even though you may be infected with the COVID-19 infection, it is still important for you to get vaccinated. Basically, with the fact that it has been found already that your natural immunity after infection doesn't last very long, so it's really important that you get that vaccination, and it almost acts like a booster dose of protection for you. So it's important for you to get vaccinated. And also we know that even though some people have been vaccinated but have had infection, but the important thing, as I've stressed, is that it reduces you from getting severe disease, or protects you from getting severe disease, and also death, and that's very important. And as we can see, also it helps to prevent the overburden on the health system, in the hospitals. If more people are getting unvaccinated and or are hesitant to get vaccinated, then we're going to keep on seeing people having severe disease and even deaths, which is really going to put a heavy burden on our healthcare system and also on our healthcare professionals who've been fighting on the front line this disease for the last 1.5 years. I just urge everyone really to consider that, and just to be able to help those frontline health care workers, and also just generally the people in trying to control this pandemic. It's more than 1.5 years since the COVID-19 pandemic, and I know that a lot of frontline healthcare workers, those that are here in Fiji, have been fighting and helping to control this infection over this period. And I can fully understand, for one who has worked also in the front line and helped not control COVID, but control other outbreaks that have occurred in Fiji. I know how it feels, to work in the front line and night and day, and many of us not seeing our families. For you who have not seen your families for weeks, because after you've worked, you also need to be isolated and quarantined, and so it's really a stressing time for many of you. And I just want to take this moment just to thank you all and say Vinaka Vakalevu for all the work that you are doing, and the sacrifice and commitment that is there to be able to help our people. I think we are all there for you and thinking about you, and also our prayers are for you as you do this important work. And I know that it's not only in Fiji that healthcare workers are working so hard, but also even in the other countries, even those that have not really had this widespread community transmission that's happening in Fiji. But we know that there are many countries that are repatriating their citizens into their countries, and also are doing the kind of work, quarantine work, and also contact tracing work that takes a lot of time and a lot of effort for healthcare professionals. And we just want to say thank you also to you for all that hard work and your efforts to protect your people and your communities.